Hey everyone! Today we're diving into a topic that's both critical and heartbreaking: how social injustice is literally killing people around the world. Let's break it down. So, a new World Health Organization report, backed by research from UCL's Institute of Health Equity, has some pretty shocking revelations. The goal was to halve the life expectancy gap between different social groups within countries by 2040. Spoiler alert, we're not even close. In fact, these gaps are getting wider. Imagine this. There's a 33-year difference in life expectancy between the country with the highest life expectancy, Japan, and the country with the lowest, Lesotho. 33 years. That's a whole generation. While there's been some progress, it's nowhere near enough to meet the 2040 target. The primary culprits? Social circumstances, where you're born, grow up, live, work, and age, and inequalities in power, money, and resources. Let's take a closer look at the UK. The UCL Institute of Health Equity reports that health inequalities have actually worsened. Between 2011 and the start of the COVID-19 pandemic, 1 million people in 90% of areas in England lived shorter lives than they should have. National life expectancy has stalled and inequalities have widened. The north-south health gap is growing, with the most deprived areas in the northeast experiencing the largest declines in health and life expectancy. It's a grim picture, but it's not all doom and gloom. The WHO report suggests several ways we can tackle these health inequalities. First, we need to address economic inequality. Investing in public services and infrastructure is crucial. Strengthening social protection and dealing with commercial determinants of health are also vital steps. And we can't forget international collaboration to create fiscal space for addressing social determinants of health. Empowering local governments and supporting community engagement are key. All of this needs to happen while addressing the climate emergency. Yeah, it's a lot, but it's possible. So, what's being done locally? The UCL Institute of Health Equity is working with local governments, businesses, and community organizations in over 50 areas across the UK, including all of Scotland and Wales, to prioritize health and reduce health inequalities. It's a mammoth effort, but it's one we desperately need. Social injustice is killing on a grand scale. But we can change this narrative. By tackling the structural drivers of health inequalities and investing in long-term solutions, we can create a world where everyone has the opportunity to live a long and healthy life. Thanks for tuning in, folks. If you found this video insightful, don't forget to like, subscribe, and share it with your friends. Let's spread awareness and drive change together. See you next time.